Chapter 18, Course and Complications of Chronic Urethral Gonorrhea. Chronic gonorrhea is gonorrhea lasting more than 3 months. The term is arbitrary and by no means strictly accurate, for chronic gonorrhea may be interrupted by acute relapses of the disease without thereby ceasing to be chronic. And chronic gonorrhea may begin and end from the clinical as well as from the pathological standpoint within the 2 months usually allotted to acute gonorrhea. Course. Gonorrhea becomes chronic because the urethral lesions caused by the gonococcus persist. These lesions may harbor the gonococcus alone, or in connection with other bacteria, or simply other bacteria without the gonococcus. They may involve the anterior or the posterior urethra, or both. Chronic gonorrhea is therefore to be subdivided either as gonococcic and postgonococcic, or as chronic anterior urethritis and chronic posterior urethritis. The clinical course causes of chronic gonorrhea are not worth enumerating in detail. Any interference with the proper treatment of acute gonorrhea may permit it to become chronic. In some instances, it becomes chronic in spite of the best treatment. Varieties. Study of the flora of chronic gonorrhea, page 166, shows the rapidly decreasing importance of the gonococcus and the rapidly increasing importance of mixed infection after the 3rd month of the disease. No further subdivision is possible. Apart from the gonococcus, no bacterium has shown itself peculiarly virulent in the male urethra. Non-gonococcic urethritis is usually post-gonorrheal. Gonococcic chronic urethritis is distinguished clinically by a tendency to be more severe, to relapse more viciously, to resent the trauma of instrumentation and alcohol more sharply than does non-gonococcic urethritis. Yet these clinical distinctions are both vague and relative. They have meaning only to the expert. A specific urethritis may be latent for months. A non-specific one may be peculiarly virulent. To distinguish the symptoms of chronic anterior urethritis from those of chronic posterior urethritis is a necessity, but clinically, the two usually exist together, the one or the other predominating.